Hello everybody, I'm delighted to join you today as part of your Public Health and Healthcare Systems module, which this part of the module focusing on public health in practice. My name is Barry Causer and I'm the Head of Strategic Commissioning in the Merton Council Public Health team. If you don't know it, Merton Council is a local authority in southwest London. You may recognise us as the home of the All England Tennis and Croquet Club, which is the venue of the Wimbledon Tennis Championships. What can I tell you about Merton? It's a good place to live and to work. It does well on most of those key indicators, including health indicators, but this really does mask some inequality between East and West Merton. Clearly, the reducing of that inequality and that health inequality is a key part of the work that we do in the Merton Public Health team. For this session, I'm going to talk to you a little bit about my role, what I do in a frontline public health team, and then, unfortunately, I'm going to set you a task for you to consider before our virtual session on Thursday, the 22nd of October. Within Merton, we are a strong but relatively small public health team, and we have a modest public health grant provided to us by central government. We have this year, in 2021, about a public health grant of just over £10 million, £10.5 million, which is the equivalent of £49 per head of population. My job, I'm the head of strategic commissioning, so that means that I'm part of the senior leadership team along with two consultants in public health, and as a senior leadership team we set the approach and the strategy for all aspects of public health and those partnerships that we need to develop to deliver in Merton, and that is led by our Director of Public Health, Dr. Dagmar Zuna. One of the key parts that I lead on as part of my role is the 3-week public health placements that King's students have with us. So I know that I've met some of you before, and no doubt I will meet some of you in the future. It's really important to say that within Merton, we take those placements very seriously. We try to give students a full rounded picture of public health in local government, warts and all. And we really make an effort, I think, to provide real projects that are going to clearly meet the learning objectives for your course, but also to push forward some of those key areas of work that we have within the borough. My main role is to lead and support a team of senior public health commissioners and public health staff. I have a wide, busy and varied portfolio that covers a range of different parts of public health. Just to pick up some of those key areas within the older people's portfolio, myself, my team, we lead on the commissioning of the Dementia Hub in Merton, and also our community-focused Dementia Action Alliance. And that alliance aims to make Merton a more dementia-friendly place by working with our community colleagues to make pledges to support our ambitions, but also to train up a network of dementia friends so that people can understand just a little bit more about dementia, and then also inspire others to help people living with dementia to live well within Merton. Other areas of work around the older people's portfolio are the development of key strategies. Most recently, we have completed and published suicide prevention strategies and a carers strategy, which is just about to be published soon. So very much about those operational delivery and commissioning services and programs for public health, but also the strategic side, working with our partners. On the health improvement portfolio, we commission stop smoking services, other health improvement services such as NHS health checks. So that's actually one of the very few mandated public health services that we have to deliver according to the public health mandate that we have. Responsibility for our Tier 2 weight management also sits with local government, although not mandated. Our approach within Merton is to signpost on to self-care and light touch support from our commissioned services, but we also signpost to commercial weight management services supported by NICE guidance. And also, really interestingly, we're working with our primary care networks at the moment to potentially recruit some dietitians to work within general practice as a key part of their network. Around the substance misuse portfolio, we lead on substance misuse, so drug and alcohol services. So we commission adult services for drug and alcohol services for our residents. And we have seen an increase in alcohol use throughout lockdown period, for example. And so we need to work with those providers to see how they're going to respond to that ever-changing environment within the borough, and which is no different to London and national levels. And we're also working with our GP colleagues again on working towards a shared care approach to supporting people in Merton. I guess as well as that commissioning, that strategic side, the key part of my role is really to work in partnership with stakeholders across the borough. We have, as I mentioned earlier, such a small public health grant that we have to work with and through others to be able to deliver and tackle those health inequalities. Some of the partners and stakeholders that we work with are adult social care. So, for example, we are working on programs to identify and then deliver interventions to older people to prevent, reduce and delay the need for formal social care. Then we also work with our CCG colleagues to deliver on the health and care plan for Merton, which has a key focus on delivering holistic good services, as the health and wellbeing strategy has the priority for healthy place. And the key to reducing those health inequalities are healthy place and healthy holistic services working hand in hand. Clearly can't talk about partnerships without talking about the community and voluntary sector, who do some amazing things at the moment, and they always have. They're increasingly being put under significant strain because of the services that they deliver on the front line are doing such great work. Difficult for me to talk about public health on the front line without mentioning COVID-19. So it's an incredible, difficult time for all of us. There are many of our residents that have faced a disproportionate impact on themselves and the communities in Merton. Some of these include our BAME communities, older people, younger people, carers, and our residents with learning disabilities, just to pick out some of those. And clearly our COVID-19 response, we weren't expecting this pandemic. And so this is on top of the business as usual that I'm kind of talking about as my day job. So again, we are incredibly busy, but working very hard to protect our communities. The COVID response in Merton, we, like many other local authorities, published a local outbreak control plan back in June, which really sets out how we're going to work in partnership with the NHS to prevent and tackle COVID-19. And the key plank of that is about identifying, then contacting and really supporting some of those key settings in the borough, such as schools, care homes and faith settings and others, so that we can really help protect our communities and protect vulnerable people within the borough. As part of our approach and in our local outbreak control plan, we're also developing pulling together a number of services as an approach to prehabilitation. So what we're doing is supporting residents to prevent serious COVID, for example, by stopping smoking, losing weight, managing their mental health conditions. So that's an important part of the service that we offer at the moment. As my role, I sit on the Outbreak Control Group, which is a cross-London Borough council approach. And again, you'll have heard much in the press recently about an increasing role for local over national. So indeed, within Merton, we are taking on some of those responsibilities for case finding and contact tracing responsibilities from national. So again, there are additional responsibilities that we're taking on in a frontline public health team. Last bit on COVID-19 is again about my role. So I lead on the community engagement theme. which really sets out how we're going to work with the community. We will not be able to prevent and manage outbreaks without the support and working closely with our community. Just one part of this is we have developed a network of community champions. So these are residents, officers, councillors, elected members that have stepped forward to be part of our approach to tackling COVID-19 within the borough. So we have a drop-in session. We do one on a Wednesday at 12 till 1, and then again we run the same session on 7 till 8 p.m. at night, where we get to listen to the community, we explain some guidance, we bust some myths, we answer any questions, but really importantly, we then share messages and campaign material so that our champions can forward them on. So for example, we have a WhatsApp group, so if we get a new image on the new guidance of high across London, for example, we can WhatsApp them that image to our community champions, who then quickly and relatively efficiently can then forward it onto their networks, their family, their friends, etc. Final part that I'm going to talk you through is about my role as a NICE Centre for Guidelines Expert Advisor. So I've taken part in public health advisory committees that have developed national guidance and quality standards around physical activity within the community or children and young people. And also most recently digital behaviour change interventions, which was published last week. And digital is a really interesting topic, as there's been much around health inequalities about digital is a fantastic enabler for many to access services, but it's also a significant barrier. So I would encourage you to have a look at that NICE guidance, which looks at the most recent evidence on the digital behaviour change interventions. You've probably heard enough about me and the job that I have, and so unfortunately I do need to set you a task for you to consider in advance of our discussion on Thursday. So the task is as follows. The clinical chair of the local CCG has approached the Health and Wellbeing Board and suggested that the medical model has failed, and to ask the board to consider developing a whole system approach to tackling diabetes. Your Director of Public Health has asked you to present a report at the next meeting with a proposal of how to take a whole system approach forward. We ask that you consider how you will respond to the Health and Wellbeing Board and add your thoughts onto the Padlet for discussion at our session on Thursday. Some key things to consider whilst developing your response and giving it some thought in advance. What is a Health and Wellbeing Board? What does it do? And who sits on it? Which organisations are represented on a Health and Wellbeing Board in local government? What is a whole system approach? What is a whole system approach for diabetes? And then thinking through who will you talk to develop the proposal, that scoping stage, who do you need to contact and have a discussion with? Then thinking about the approach. What approach are you going to take? How will you deliver it? But who will you work with at that implementation phase? So it's not just you in public health that has the responsibility for delivering the whole system approach. Finally, measurement. So how will you measure or track the progress of your whole system approach to tackling diabetes? Thanks for listening to this short video. I hope you found it interesting to hear from me on my role in frontline public health. And I'm really looking forward to Thursday where I get to meet you. And so I will see you soon. Bye now.